Welcome to our first episode of Voices from the Frontlines, a podcast series that we've launched for discussing humanitarian issues from our operational areas all around the world. Today, we'll be delving into one of the most urgent humanitarian crises of our time, the ongoing situation in Gaza and the West Bank, where relentless conflict has severely impacted the health and well-being of millions of Palestinians. Since October 7, 2023, the escalation of violence has led to a dire public health emergency with countless people in desperate need of medical attention, resources, and support. Joining us to discuss this pressing issue is Louise Bichet, Head of Middle East Programs at Médecins du Monde. Louise will be giving us on-the-ground perspective on the current situation, what Médecins du Monde is doing to respond, and how the public can support our efforts during this critical time. Thank you for being with us, Louise.
Thank you.
To begin with, we would like to reflect a picture about what life has been like for Palestinians since the escalation of violence on October the 7th for our listeners. The humanitarian toll has been staggering, with families, children, and the elderly suffering from the impacts of the war. The healthcare system, which was already strained, is now facing unprecedented challenges. Louise, can you tell us more about the current situation on the ground? What are the most health-related needs that Médecins du Monde is addressing?
Yes, of course. Well, the situation on the ground is, I found a bit harder and harder to describe it. It's difficult to find the right adjectives, but it is catastrophic at many levels. I would say that for what we know, from what we see, well, you know that people have been displaced, forcibly displaced 6 times, 7 times, more for some of them. So it's a chaotic context where indeed it's a struggle for the civilians to find a place to stay. And I'm not saying in purpose safe space, because there is no such a thing in the Gaza Strip right now. There is no safe areas where families, children, elderly people could find a bit of rest. So without even talking about health and health needs, well, the first thing would be security, because there is no health in general if there is no minimum level of security. So the first thing that we ask and that Médecins du Monde is asking and working for is a ceasefire, and that would be really the first step. But then, in terms of health, what we see in the medical points and the clinics that we are running on a daily basis is a whole range of difficulties and disease and infections. The first disease that our medical teams are seeing and treating are skin disease, and very close to respiratory diseases or infections. These are the 2 major reasons for consultation. It's a lot due to the living conditions of the families, again, the civilians, and it's a huge and it's easily spreading within the communities. So that's the two first reasons. And there is a lot of other health disease or difficulties, like chronic disease, for example, which are not treated well, not followed well as it used to be. And I would say that what is really remarkable is that what we see on the medical points are treatable disease very easily. It's not very complicated to treat hepatitis A, for example, but the fact that the living conditions are not satisfactory, the fact that people are keeping drinking non-drinkable water, for example, or have struggled to find food, very basic food, are leading to very difficult situations and health conditions that are deteriorating very fast. For children, for example, for a child who is malnourished, for example, it would be even harder for him or for her to fight against a very simple conditions such as hepatitis A, for example. So it's really a vicious circle, and that's one of the things that we see on the ground. And last point, maybe to answer your question, is the mental health, of course. It was, that before the 7th of October, of course, there was already a blockade. It was already a very difficult situation inside the Gaza Strip. And Médecins du Monde had worked a lot on mental health issues and more generally the mental health systems in the Gaza Strip. But the fact is now it's getting even worse. I was talking about the fact that chronic disease were not treated. Well, it's the same for psychiatric issues, for example. The drugs are not available anymore for most of them, so it's really difficult to contain this kind of situation. And more generally, people are traumatized. They have all experienced horrendous situation, extremely traumatic situations. They lost. It's very simple. They all lost someone from their families or friends or relatives, and we can see that also again within the children. And you can see children that cannot sleep, for example, who are wetting their bed, for example, who are scared all the time, and it's a continuous stress, and it already have some impact, of course, and it will have in the long term.
Thanks, Louise. Thanks for the detailed information. While the situation remains dire in Palestine, organizations like Médecins du Monde are providing critical services to help those in need. What exactly is being done on the ground, and how is Médecins du Monde managing to deliver healthcare services amid such challenging circumstances? Louise, could you share with us what healthcare services Médecins du Monde is providing to alleviate the suffering, and what partnerships or collaborations have been instrumental in making this work possible?
Yeah, maybe to give you a bit of an overview, we started 2 first medical points in Rafah, in the south of the Gaza Strip, between December 23 and January 24. So we were running 2 medical points in refugee camp and in the school where a lot of people were sheltering. And suddenly in May, when the Israeli army invaded Rafah, we had to move the 2 medical points, our new office, because our previous office in Gaza Strip had been destroyed and not accessible, obviously. So anyway, just to tell you that it's the humanitarian response is quite hard in these conditions, of course. So we moved like the civilian population in few hours. We found some trucks to move all the drugs, all the materials that we were successfully gathering before, and we reopened new medical points in May, just after in the middle area of the Gaza Strip, so in Deir el-Balah, and then afterwards in Khan Yunis. So we have now 4 medical points that are clearly overcrowded. It's like 1,600 patients a day. It's a really, really intense rhythm of work for our medical team. And what we provide is what we call primary health care. So it's basically what you would find if you go for a consultation to meet a general physician. So we provide vaccination, of course, which is, of course, extremely important right now, especially for children. We do have family planning consultation. We do follow-up of pregnancies follow-up of newborn. We do have, of course, mental health or psychological support services in the medical points. We also provided follow-up of war-related injuries. There are quite a number of people who come for that, and that's basically what we do on the ground. We do work in partnerships with other organizations that are providing healthcare as we do, but I would add that to make this possible, to be able to run 4 medical points, it means to be able to get some supply from the outside, which is of course extremely complicated in the context of the total siege that is imposed in the Gaza Strip. It means that we need first to be able to negotiate with all the parties, and it's not easy every day. But to be very concrete, it means that we are in constant communication with the Israeli side, trying to negotiate the entry of trucks and to get some drugs and some medical materials. It means also to be able to have a daily conversation as well with the Hamas inside Gaza or other groups inside the Gaza Strip. So this is also the specific place, the specific role of non-governmental organization or humanitarian organizations such as Médecins du Monde is an organization which is able to talk with different parties just to be able to do humanitarian work for all the populations. And lastly, we've been, of course, working with the whole network of Médecins du Monde, and sure, especially with Turkey, who has been also able to provide drugs and medical materials for our medical points inside Gaza, and that was extremely important.
Thanks, Louise. Delivering healthcare services in a conflict zone is never easy, and in Palestine, the obstacles are at an immense level. From access restrictions to severe shortages of medical supplies, the challenges faced by healthcare workers are profound. Louise, could you give us some insight about what it is like for healthcare service providers trying to operate in such a dangerous and unpredictable environment? What are the major obstacles they are facing and how they are managing to push through?
What we can start with is to say that the medical team, our colleagues that are working on the ground every day, are facing exactly the same situation as what we described within the civilian population. So it means that they also have been displaced 6 times, 7 times. They also have no houses. They have barely a shelter where they can sleep with their families every night. But a lot of our colleagues are sleeping under tents, for example, and they don't have any houses. They are not sure whether they will be able to find drinkable water or enough food for their families. So again, they are facing the same, and they also lost a lot of their relatives. And I'm not going to describe all their stories, but they all have stories. We all lost one colleague, Maysara Reyes, who was killed in his building last November. So yeah, they are facing really the same situation. So it's really difficult. They should be protected, like the civilian populations, within the international humanitarian law, which we call IHL. IHL is commending Israel to protect civilians, but also to protect health workers, humanitarian workers, health infrastructures, they have to provide the security, and clearly they are failing right now. So this political decision, because it is a political decision not to protect civilians and humanitarian workers and health workers, is a crime, clearly. So again, they are facing the same situation. And on a daily basis, what it means that if they are going when they are going to work every day, they are not sure whether they clearly a bomb is coming on them or not, because it's bombing every day, all the time. So it's the level of risk taken by our colleagues of Médecins du Monde is extremely high, and it requires a lot of courage to be able to provide healthcare in this situation when you are yourself also a potential target. So that's clearly the reality now, the daily reality for our colleagues.
Thanks, Louise. Now, more than ever, solidarity and support from the international community are essential to continue life-saving efforts in Palestine. Médecins du Monde has launched a campaign to rally support for its critical work. Louise, can you tell us more about this campaign and explain how our listeners can get involved and help to contribute to the mission of Médecins du Monde during this critical time?
Yeah, I would see two main ways of being involved for people who are listening. The first one is the mobilization. The fact that civil society and the international civil society is saying out loud that they are not supporting a war like that. They are not supporting crimes against humanity. They are not, and they are raising their voices to require, to ask very firmly, very strongly for a ceasefire. That they ask their own states to push all they can for a ceasefire. It's really something that we are also looking for. And because we are doing a lot of advocacy, and advocacy means really to ask for a social change, it means that it's also part of our work. So we do have operations on the ground, and it's really, of course, what is extremely important. But based on what we see, we testify and we use this to require for a change. And again, our collective request, our collective demands is a ceasefire. And I would add that the third states, meaning the states or the groups that are not directly involved in the war, must respect the Geneva Conventions, and they must do everything they can to push the groups that are involved in the war to respect IHL, to respect international human law. It means that all the states, and of course the US or European states or Turkey as well, the states, have the responsibility to put all the pressure they can within all the ways that they want to find to put pressure currently on Israel, because that's the main target, to respect IHL and to do everything that is possible to protect civilians, again, to protect the health workers, etc. And the second way is, of course, financial support, because financial support is helping us to provide the healthcare I was talking about earlier. When we have support, financial support, it means that we can very simply purchase the drugs, medical materials, but we can also hire more medical team. Our current team now in Gaza is exhausted. I was talking about the fact that the medical points were overcrowded. We need support, and we need more medical teams because the needs are tremendous, are very, very high. and yeah, having financial support from the civil society is really important right now.
Thanks, Louise. Thanks for your precious time and giving us information about the on-the-ground perspective in Palestine. Thank you.
Thank you for having me.